There's 4 of these: extension, flexion, adduction, and abduction. So again, I won't demonstrate with the weight on my ankle, but you just strap the ankle weight at the most distal part. And again, just have a forward toe towards you for flexion. Just keep the legs straight, raise the high as the opposite knee, and then slow all the way back down. That's flexion. Adduction, have to cross your leg over. Pull the leg towards themselves, keep the leg straight again. Then there's extension, ankle weights on the ankle, don't let the hips rock. Then there's abduction. Again, not too high, not too low, just right in the middle. Keep the leg straight, the opposite leg will be bent. And that's H20. Next, we have a hip internal rotation with the TheraBand. So you just tie a band real tight, wrap it around their ankles here. A pillow, use a pillow or a small bolster like I'm using. Have them sit where the feet are dangling, and I'm just going to pull the ankles apart. Pull for a good second or so, and then back. You can do one at a time, or you can do them both. Most likely they're going to be weak on one side or the other, so I just like to do one at a time. Another way that you can do this exercise would be, as a therapist or assistant or whatever, just wrap this around their ankle, have them sit here. The therapist will be sitting on a stool or something. You're just going to hold the TheraBand, have them pull out, and just it's important just that the knee is locked. I'm not doing any of that. So that's another version of that. Next would be standing flexion, extension, adduction, abduction with the TheraBand, which is H22. For this one, you would tie the TheraBand to something low. I just got a loop here, a big loop. And I'll demonstrate facing this way. So if the left leg's the affected leg, just have them slide one leg in there. So the non-affected leg's behind the TheraBand. Feet are together. You can have something for help to help them balance. This is abduction first, so away from the body, keep the legs straight. And it's all times you'll see them rock. So try to keep them nice and tall. Should feel all the way down the side. So this is abduction. Next will be flexion. Step over the band. And flexion through here. Have them walk out to feel some resistance. Keep the legs straight. This requires some stability from the opposite side too. So next would be adduction. So have them step away. Bring the band. Throw the band. But you get the idea. The band would be wrapped around this one. Have them step out a little bit. Pull the band towards the unaffected leg. Work on the adductors here. And then next would be extension. Again, the band will be wrapped around the ankle. Stand nice and tall. Just have them rock. Bring their legs straight back. Again, you'll see them lean over. We just want to keep them nice and tall while we do that exercise. And that is H22. Next we have H23, which is a single leg bridge. Again, I have the leg back in supine, bridge position. Feet are kind of shoulder width apart, make it harder, feet together. Just have the bridge up. The goal is to have the body in a straight line. Control breathing while you do this exercise. I'm just going to kick one leg out, back down, relax, up, kick out, toes towards them, back down. Again, hold for 3 to 5 seconds at the top. Next is H24, which is the wobble board. Grab it. Again, we'll go forward and back, and then we'll twist the board and go side to side. So again, just kind of note to tell them that their arch of their foot's kind of on the nail holes. Again, put them close to the wall so they don't fall. Just have the patient try and balance in the middle. So forward and back. Again, try to get the arch of the foot centered with the board. And just try to balance in the middle, one side to side. Set a timer for 1, 2, 3 minutes. Progress them like that. Next is the physio ball squat, which I'll demonstrate over here on the wall. We'll put the ball in the arch of their back. You're going to have lean back on the ball. So the body's at an angle. Feet are shoulder width apart. My toes are pointed straight. And I'm just going to squat down. Notice my knees don't pass the front of my toes. It takes less pressure off the knees. We're going to try and come down, keep the shoulders back. We want to come down at 90 degrees at the hip and knee. Hold that for 3 to 5 seconds. And then back up nice and slow. Again, shoulders are back. Hip and knees are at 90 degrees. Toes are pointed straight. Feet are shoulder width apart. Balls in the arch of your back. Next is a single leg balance with the eyes closed. Again, just get them close to the wall if they need it. Just going to balance my legs straight with the other one. Going to keep them nice and tall. Hold that for 10-15 seconds. Make it harder, you can have them stand on Bosu ball, dino disc, something like that. In this one we have eyes closed. So next we have H27, which is just a forward lunge. I'll just step a little forward a little bit. The forward lunge, we'll do both sides no matter if one side's affected or not. So basically toes are straight. We're going to lunge forward to where your knees can almost touch the ground. That's the goal. And then back up nice and slow. We're going to alternate legs. Maybe start with 5 on each leg. Nice and slow. It's important to get a big step. It's a small step. It takes a lot of pressure on the knees because you'll notice the knees will pass the front of the toes here. So we're going to take a larger step. Down and back. Go. You can even have them put their hands on their hips for that one. And then lastly is H28 for phase 2, which is a tandem heel toe walk. Eyes open or eyes closed. So again, toes to the back of the heel. You have their arms out a little bit to help us balance. Go back, make a wide circle, go forward, and have your heel touch your toe. Back, big circle in front. Come here, and you can make them wobble a little bit, try to make it harder on themselves. And that concludes phase 2 of the hip.